Health and Care Economics Cymru, and we're in the business of providing the health economics advice and support that would help enable someone to deliver on their application and their own sort of fellowship objectives. So we really would be providing that advice and support as mentors, for example, or as supervisors. That would be very important if your plans were to have a large health economics component, anything from sort of, understanding the cost right through to perhaps even doing a cost effectiveness analysis. So I think anything that sort of fits within that health economic pathway and is one of your objectives, I would advise that you potentially seek out a supervisor or mentor from a health economist. That said, particularly as you may go up up the fellowship ladder, you may want to develop your own health economic skills and expertise. So again, that would be very important if you were doing that within your PhD. You would need to have a health economics supervisor. At the next step and advanced stages, then again, if you are looking to seek that objective and you want to have training, you should have that mentorship in place. But you may want, if it's a small piece, to invest in having some health economic support costed into your application. So that necessarily wouldn't be somebody who may be acting as your mentor, but maybe, for example, in HCEC, we've got fantastic research team members who may be able to give that more hands-on support through actually conducting the health economics for you, so that you as a PI can learn a little bit about how health economics can add value to your research, but not necessarily want to become a health economist yourself. We're part of the multidisciplinary team. So if you're looking at developing yourself as a principal investigator, then learning how those, how you can bring those multidisciplinary skills and expertise into developing your research is also incredibly important. Okay, so again, it's about the question you're trying to address, and also where your fellowship ambitions lie. So if you really do want to develop as a health economist or an applied health economics researcher, then yes, you would need to get that expertise in and quite substantially into your fellowship application. But as I said, if there's just a question that you think might be asked, and particularly we're into looking at, how best to allocate scarce resources, you might want to understand some of the costs behind that. It even might be some qualitative work to just understand, where those costs and outcomes lie as you sort of develop your research. Then that might be needed. There's lots of research though that won't need health economics. We're here for right time, right place, and so please, it will depend on your questions and the your ambitions as a researcher. I was to say, if there's any doubt, then just come and talk to us. We'll probably give you an answer very quickly, whether or not. I don't think I wouldn't want it to be mandatory that you have to have a health economics say yes or no to this, but I think to use your own judgment. See our webinars, for example, which tells you a little bit about what health economics is. We're always at events. Come and see us at the Health and Care Research Wales conference and other events that we'll be part of in the faculty, and we can just have a very quick informal chat with you, and that is often just enough to reassure you when you don't need health economics in your fellowship application. I'll talk about this in two things. So obviously, if you were putting together your doctoral and even your advanced fellowship, and there was a substantive part of that that required some health economics expertise. So somebody like me, and I do this quite a lot already, would come in as part of your supervisory or mentorship team. Because again, if you're very heavily weighted in health economics, you probably would want to do your PhD, for example, in a health economics centre to get that reward. If it's more multidisciplinary and one aspect is the health economics, then yes, we'd come in as a supervisor or mentor. Now, again, costings is usually that's down in as an academic, so that we would want to support. I mean, certainly, we are based in Swansea and Bangor in Health and Care Economics Cymru, so we'd want to make sure you're in the right place. So, for example, if it was your work was focused on, say, early years or prevention or public health sort of orientation, then I might say that, my colleague Professor Rhiannon Tudor Edwards and her team are maybe more suited to that. And I know Rhiannon certainly helps with providing support as a supervisor and mentor. So that would be quite a large component, but that would be coming in to give you that academic support and advice. And even if you're based, say, elsewhere, where I'm based at Swansea University and you're based in Cardiff or Bangor, then we might say, well, we can come in as an advisor and help that. And I do quite a lot of that type of support. If you are looking for a more bespoke, someone to actually help you and actually deliver some health economic analysis for you, then that might have to be costed in terms of the researcher. I certainly wouldn't cost myself into that because A, I'm too expensive, and B, probably not as hands-on as I used to be. So that I'd do is we'd introduce you to one of our health economics researcher. But I think as well that we have to be quite careful in our fellowship awards. Certainly if it's doctoral and you're training and advanced, then you wouldn't be expected to have somebody full-time as your health economist on your fellowship application. So it has to be done fairly prudently, and certainly I'm sure the panel would look very closely about why do you need to bring in that specific piece of expertise as an external person onto your fellowship application. Okay, well, best time to contact us is early on. As I said, get to know your health economics friends across Wales. There's quite a few of us, so certainly come and talk to us informally or send us an email, and we'll do our best to respond to that very quickly. As I said, we can usually tell you whether or not health economics is needed very quickly just by giving us a paragraph and maybe some of your questions that you want to ask. We always want to help, and I'm absolutely obviously a great believer and champion of our fellowship awards within Health and Care Research Wales faculty. But again, we would do you a disservice if you came to us very late in the day, particularly if costings need to be involved. I think one of the things we forget is that if you're wanting a supervision or mentor, that we have to give you a very detailed statement of support. We're not asked just to give you a letter to say we'll be your supervisor, but we're required to give a very clear articulation about what we can add to your fellowship application, because that place will be around those people that are on your team to support you. So yes, I would certainly say that it has to be done as sooner rather than later. Give you example, the advanced and doctoral fellowships tend to occur at early January. Please contact us early December, whilst we go in at the latest, really, because we're going into Christmas and New Year, and there won't be nothing more frustrating than when you just don't get that response back because we're not around, and that would be such a shame. So yeah, sooner rather than later. So again, we'd want to see all that preparation and due diligence done as part of you putting your fellowship application together. You can sort of tell when somebody's maybe rushed it a little bit because those sort of really important components are missing, and they're judged as part of the the whole application. So yeah, please give attention to who you bring in on your team as much as what you write, for example, on your project. I think to be too ambitious and to think that you can do it without that support in place. Healthy, specifically to health economics, it is a it is a subject that might be new to you, and on the surface it might look quite simple, and sometimes it is, but I think if you really want to get that health economics thinking and the application of the best methods and to learn about what health economics can do, then I would say, you know, seek support and mentorship appropriately.